Okay, let's talk about guidelines now. What are the guidelines for physical activity? For whom are those guidelines written? And for what purpose, really, are they written? Let's first discuss the guidelines for health benefits. So these are the guidelines that help you reduce your risk for chronic disease or the risk factors for chronic disease, such as high blood pressure, high cholesterol, um, which we call dyslipidemia, and things like that. These are not the guidelines to increase your fitness and wellness if you're already an active individual. These guidelines will also be recommendations for the minimum amounts of activity that American adults, children, elderly, and pregnant women eventually will need to engage in for health benefits. So specifically, we know that there is strong evidence with regard to physical activity in that there is a dose response for a certain amount of physical activity, which will reduce the risk of mortality and morbidity. So reduce the risk of mortality, early death, also reducing the risks that are involved in coronary heart disease, stroke, high blood pressure, again, dyslipidemia or adverse lipid profiles, type 2 diabetes, and cancer specifically. Research indicates for the reduction of colon and breast cancer. Now, an important point to make here is this is a minimum dose of physical activity that is necessary to lower your risk. It doesn't completely eliminate this risk, but we know that there's a dose response effect so that the higher the levels of physical activity, the lower and lower your risks will be associated with these chronic disease conditions. Now, there is also specific recommendations for the prevention of weight gain. So this is kind of the minimums to prevent weight gain in most people. Notice this doesn't say to produce weight loss. The only way that these guidelines could produce weight loss is if they come simultaneously with a reduction of caloric intake. And most research indicates that these recommendations for health benefits actually do not induce weight loss. So I will say that those organizations who are more closely associated with the exercise sciences will tell you that this is insufficient for weight loss for most people. There may be a few people that could induce weight loss. We also would find that those in the exercise sciences and nutritional sciences would say that the way to lose weight is to start first with diet for weight loss, add in physical activity, including both aerobic physical activity and muscular strength or endurance activities. And these are your best combinations to actually induce weight loss, and that the dose for weight loss is much higher than the dose for health benefit. The dose for weight loss and to maintain that weight loss seems to be an hour of physical activity each day, and always seems to, and is best supported by starting with diet or caloric restrictions, nutritional restrictions of calories. We also know that one of the health benefits of this level of physical activity, particularly in those that are elderly, is the prevention of falls. Fall prevention is important because we know that the risk of death is associated with falls in the elderly, in that those individuals who fall and perhaps break a hip, often if they're over, there's a percentage that there's several percentages that are out there and I'm not sure which one to cite, but a high proportion of elderly individuals who fall and break their hip actually die within the next year. So fall prevention is very important. Another health benefit is that cognitive function is increased with at least these minimum levels of physical activity, and depression or symptoms of depression are reduced with this level of physical activity. Be cautious with regard to weight loss, but weight gain prevention, depending on caloric intake, could be a benefit as well. Weight loss could be a benefit if combined with caloric intake, and often if muscular strength as well as aerobic exercise is undertaken. So I think it's best to start young to old. So we're going to start with those recommendations for children, school-age children, and adolescents, so children ages 6 to 17. It is recommended that children ages 6 to 17 actually engage in 1 hour or more of physical activity daily. That says daily. Now, most of the 60 minutes each day should either be moderate or vigorous intensity aerobic activity. Aerobic activity means that you have repetitive contraction of muscles over a long duration of time, lasting 10 to 20 minutes or more. There's a good definition in your book about what aerobic exercise is. This is the type of exercise that changes the system, systemically changes the cardiovascular system and the respiratory system, and actually those changes affect your overall health. In addition to aerobic exercise, it's recommended that on at least 3 days of the week, that muscular strengthening exercise or physical activity is engaged in by children as part of the 60 or more minutes of daily activity. And with children, bone strengthening is important. It's important that there is some running, jumping, weight-bearing exercise, which would cause activation of the epiphyseal plates, basically stimulation of the growth plates or the epiphyseal plates of the bone, which increases the bone mineral density to increase the size and the strength of the bones as children grow. There should at least be some bone strengthening activities on 3 days of the week as a part of the 60 or more minutes. Now you may think, well, gosh, if they're physically active for 60 or more minutes aerobically, then they're getting those bone strengthening physical activities. However, if they're physically active in a sport like swimming, swimming is a non-weight bearing sport and isn't the best bone strengthening activity. So beyond that, they should engage at least 3 days a week in something that will stimulate bone growth. They should be encouraged to participate in physical activities that are age appropriate, that are enjoyable and offer variety. And you have to think about what kinds of things are enjoyable and age appropriate for these age groups. 6-year-olds want to play games. Some kids want to play sports. Not all kids want to play sports. Some kids would prefer to jump rope so think about when we talk about the FIT-E principles of exercise prescription, frequency, intensity, time. We also sometimes put in type, which would be aerobic, muscular strengthening, bone strengthening, and the E, which is enjoyment. If it's not enjoyable, children aren't going to want to sustain that type of activity beyond the sessions that they maybe are required to do. Whereas with adults, there's a choice with regard to how frequently they exercise. We'll find that adults will be encouraged to exercise at moderate intensity 5 days a week or at vigorous intensity 3 days a week. But with children, there's no choice on frequency. They really need daily physical activity. Unstructured play can meet these guidelines. So unstructured play is like recess play. It doesn't have to be exercise that, as we commonly box in the definition of exercise. And I wish we would not box in the definition of exercise as much as we do. We might actually find that more people would exercise if we could expand what they think of as exercise. It also requires some vigorous intensity activity. Moderate activity only isn't sufficient for children. And that's what research studies tell us. It's not sufficient to actually reduce their risk of disease and actually the incidence of disease occurring earlier in life. Now, with regard to how much vigorous activity or how much muscle strengthening, bone strengthening, I have to say uh, there is varied research and varied recommendations in the research literature, which is why you don't see a specific recommendation to the amount or time of bone strengthening or muscular strengthening or vigorous activity, just that it should be a part of a child's activity program. Um, And it is a challenge to figure out how much activity kids are getting. If you think about unstructured play, send kids out onto the field for recess or on a playground for recess. How much physical activity do they actually get? You'll see some kids sitting around and talking under trees, pulling grass out of the ground, doing things that wouldn't really be moderate or vigorous intensity activity, while you might see another group of kids running, playing tag, definitely meets that criteria. Children are hard to track for a lot of reasons. Often we use pedometers to track movement with adults, which basically is step counting. And you have an accelerometer in a case, and as the accelerometer is perturbated, it moves up and down with normal walking motion. You can count steps and kind of quantify how much physical activity somebody has done. Put a pedometer on a child, and for one, they don't usually mimic normal gait patterns, walking patterns of an adult. And that thing is shaken left and right and up and down and sideways, even half the time when they're not really engaged in physical activity at all. So it is difficult, but you want to at least encourage to try to get to this amount of activity. It doesn't mean that you'll always get it exactly right. Now, with young children, putting them in an aerobic circuit in the gym probably wouldn't work. They're better off really running around on the playground, playing, common group games, things like that. But as children age, structured activity actually becomes more important as a means of attaining the physical activity minimums. And part of this is that we see children being less engaged in physical activity when given free choice as they age, because they are growing, and sometimes fatigue sets in for that reason, and for a lot of the reasons that are just sociocultural in nature. So actually giving them places where we can engage them in activity in a more structured way is more important as children age. Part of this is a reflection of their need for skill development, to give them the skills that they need to participate in more common activities in their teenage and adult years. Part of this is to make sure that we reduce overuse injuries. We make sure we know what types of activities people are doing and how much they're engaged in these activities. We're less at risk for overuse injuries as children than we are as we increase in our body weight, and the structure of our body changes through puberty. And as well, structural activities can produce fun, socially engaged activities. When students are engaged with other people, and competition can be used to help children as they age adhere to exercise programs and those recommendations of minimum amounts of physical activity. There are recommendations in some of the first parts of the physical activity guidelines that affirm the importance of physical activity to children younger than 6, but there's not a lot of clear evidence or ways to capture what that physical activity is. We just know we want to encourage younger children, preschool age children, also to be as physically active as possible. There are physical activities that are recommended for children with disabilities as well. We're going to minimize the amount of time we spend on this because I really want to get to the adult recommendations. And this would probably give us the need for a different length of class if we try to cover everything. So I've already mentioned several of the strategies that you might use to get that child to that 60 minutes of physical activity a day. Recess, of course, is great. Is actually the law that your child in North Carolina gets 30 minutes at least of recess each day. Not sufficient with regard to the amount of activity. Physical activity breaks during the school day would be fabulous, or even when they're at home, giving them opportunities to say, hey, let's get up from the video game and let's go run and play, or, let's go throw football and, play tag, something. Have a break from sedentary activities such as academic work. PE is a great time to get physical activity, but the unfortunate thing is most children don't get PE every day. In North Carolina, in elementary schools, it is rare to get PE every day, and they're good to get it every other day, sometimes only 2 days per week. After school programs in that case are fabulous ways to get physical activity in to try to meet those guidelines. It is important also that physical activity is mentored. They receive positive feedback with regard to being physically active. Praise, rewards, encouragement. Do not use physical activity as a punishment, because that just provides the negativity with regard to physical activity that could actually curb their exercise and physical activity engagement the rest of their lives. But model healthy physical activity. Help people learn skills. Teach different sport skills. Teach different skills for games and like golf. Let's go learn to play golf, because at least if we go play a round of golf, we're walking the course, and encourage people to walk the course, of course. So sometimes skills are important to help children understand the intensity of their exercise. What is moderate intensity? What is vigorous intensity? Help them set goals to achieve certain objectives that hopefully are their own objectives. And also, in the case of sports skills, or skills that maybe rock climbing and things like that provide, which are more recreational skills, provide protective gear and promote lifetime physical activities, not just sport, although sport may be important at certain age groups and kids might be interested in that, but don't box yourself into only sporting activities or only treadmill running, and only, think about lifetime activities, things they might like to do forever, like hiking, canoeing, kayaking, disc golf, things that are just different. Now, I think this would be most everybody in this class, the category in which you fall, adults ages 18 to 64. The number one rule is adults need to avoid being sedentary, avoid inactivity. There are substantial health benefits if you get moderate amounts of aerobic activity, but there are more health benefits with higher amounts of aerobic activity. Again, there's this dose-response relationship. The higher the dose, the more the benefit. Muscular strengthening activities actually provide additional health benefits, and let me give you an example of that. So, for example, every time you do a muscular strength, you contract your muscle specifically, you are encouraging your muscle's ability to allow glucose, sugar, to get into the muscle cell itself to be used to produce more energy, right? And what we call this is that muscular contraction can actually increase your insulin sensitivity. So when you exercise, you can increase your body's sensitivity to the hormone insulin, which allows sugar to come out of your bloodstream and into the cell to be used for energy. That increases the health benefit. And the more active you are, the more you can increase your insulin sensitivity, as long as you are able to make insulin. with regard to increasing the muscle size or the number of fibers you have in a muscle, which can increase be increasing tone, the ability of the muscle to contract, or be increasing the number of fibers you have. If you have two people that are the same physical size, and one of them is made of more muscle and less fat than the other, then that person who has more muscle and less fat than the other will actually, just standing still, be burning more calories than the person who has the lower muscle fat, the lower muscle content. So we call this we call this muscle content lean body mass. And the higher your lean body mass, the higher your resting metabolic rate, which just means the higher the muscle content compared to the overall body content, the more calories you burn, not only just standing still, but also in any activity you engage in, you burn more calories. So there is benefit to adding muscle. So I work with people generally that are at risk for obesity-related diseases. I do not prescribe an exercise program that is solely aerobic exercise. I always include resistance training for muscular strength, because increasing that person's resting metabolic rate is super important for weight loss, and more important for maintenance of the weight loss that they induce by dietary caloric restrictions. And here I'd like to say this. Let's say you have somebody that is completely sedentary. Anything is better than nothing. We know that any amount of activity compared to inactivity will provide some benefit. There is some benefit to moving. So if you have an adult, or if you are an adult that is completely sedentary, you don't perform any type of exercise, do something. Something's better than nothing. And typically, when we look at these minimum recommendations, if I have somebody who's a sedentary individual and maybe also overweight or obese, they cannot necessarily start out with the minimum levels. But any exercise they start out with makes them feel better and encourages them to continue to exercise and to progressively overload the volume of that exercise until they at least meet the minimum levels of exercise. So it's not an all or none kind of thing. Obviously, to get overall health benefits, there's a minimum dose that's best, but until you're there, something is better than nothing. And that should inform you a bit for some of those discussion questions this week. So, of course, I said there's a dose-response relationship between amounts of physical activity and health benefits. So low amounts of PA do have some health benefits, but higher amounts of physical activity, PA, actually have higher health benefits or more health benefits. And for physical activity guidelines for adult communities, 60 minutes per week of relatively moderate intensity physical activity can cause small increases in fitness and lower the risk of all-cause mortality and coronary artery disease. But there is no evidence of at what threshold physical activity below which there is no benefit. Now, if we just think about all-cause mortality or coronary artery disease, that is not the only risk that we face that can actually cause morbidity, which is that change in quality of life, lowered quality of life, or mortality from other causes, right? So don't allow inactivity, the inactivity guideline, to undermine this bigger message, which is that adults really need to engage in 150 minutes per week of physical activity. Just because 60 minutes is better than nothing doesn't mean that that's the minimum you shoot for. And the reason is that we found the best results for increases in or decreases in risk or increases in health benefit at this level of aerobic intensity, where we engage in moderate intensity aerobic exercise 5 days per week, That would be 150 minutes of moderate intensity exercise each week, or vigorous intensity activity 20 minutes per day for 3 days a week, which is 60 minutes of vigorous intensity activity per week. Of course, you can do a combination of moderate and vigorous exercise to meet those recommendations as well, and the more you do, the greater the benefit. Now, there are also recommendations, which is new to the 2008 guidelines from the 1998 U.S. Surgeon General's report. There are now guidelines for muscular strength or endurance. And what that means is we talk about muscular strength. It could be body weight exercises such as push-ups, sit-ups, pull-ups, or it could be lifting weights in a weight room. Either machine weights or free weights, or it could be resistance bands, but muscular strength and endurance engaging in that a minimum of 2 days per week. Now, the American College of Sports Medicine goes further and tells you the number of exercises that you should do at a minimum and to hit most of your major muscle groups. But here, I'm just saying, you got to at least do muscular strengthening or muscular endurance activities 2 days per week, and we'll talk about the details in a moment. Flexibility. The American College of Sports Medicine and the American Heart Association recommend that everybody should stretch to maintain flexibility for physical activities. In other words, make sure that you're able to do the physical activities that you're trying to engage in, and for that you may need to increase your flexibility. And particularly maintain flexibility for activities of daily living or ADLs. Now, in actuality, I should tell you that there are no health benefits to the flexibility program, except that if your flexibility is limited, you cannot participate in the minimum physical activity recommendations. So in summary, for substantial health benefits, adults should have 150 minutes or 2.5 hours a week of moderate intensity activity, or or 70 to 75 minutes, 1.25 hours per week of vigorous intensity aerobic activity or physical activity, or some equivalent combination. When we say equivalent combination, that equivalent could be in the metabolic value, caloric expenditure that you engage in the physical activity combination of moderate and vigorous intensity activity. And we talked about MET units last time, so you should be able to kind of understand what we mean when we say the metabolic equivalent combination of moderate and vigorous intensity activities. We also know that aerobic activity should be performed in episodes of at least 10 minutes. In other words, one of the things that came out of the 1998 U.S. Surgeon General's report was one of the first recommendations that this moderate physical activity could be accumulated. Remember talking about those sedentary individuals that they couldn't do 30 minutes of exercise each day? Well, it's actually ironic that with these guidelines, they just need to do it in 3 10-minute bouts spread throughout the day, if that's possible in their lifestyle, which for most people it is. So you do need to exercise for at least 10 minutes to be in aerobic metabolism. That is the metabolism that uses oxygen to produce the calories that you're burning through exercise. That is the only type of exercise that actually stresses the cardiovascular, cardiorespiratory system. And that's where we find the health benefits from this exercise. So you can't do 5-minute bouts. There's no evidence that that's effective. But accumulated bouts, 10 minutes here, 10 minutes here, 10 minutes here, works great, and preferably it should be just spread throughout the week so that you accumulate the 150 minutes of exercise. These accumulated bouts are also great to increase the volume of exercise, to increase the health benefits. Whereas, say you're doing 30 minutes of exercise right now and you want to increase that, well, say you do two 20-minute sessions instead of one 30-minute session, and you've increased by 10 minutes a day, or a total of 50 more minutes a week, and you've gotten yourself up to 200 minutes of moderate intensity activity, and you haven't overdone it. It's something that is manageable for you. Anybody who does only light intensity activity is not meeting the guidelines. We just consider that person inactive or sedentary. If you're doing moderate intensity, in order to say that you're moderately active, you have to be participating in moderate intensity activity at least 150 minutes per week on a regular basis. And we usually say once you're doing that for about 3 months or so, you are moderately active. But you must be doing moderate intensity activity 150 minutes of the week minimum to say you're moderately active. Again, those bouts need to be in a duration of minimum 10-minute bouts. Or they can be longer than 10 minutes. But without at least 10 minutes of exercise, you don't get the same metabolic adaptations or responses and adaptations to the system that you do with a 10-minute bout or more. Again, we have found total physical activity in most studies is usually accumulated from activities that are varying modes of activity, but unknown duration. Known, it's difficult to study if the health benefits of one 30-minute bout are exactly the same as 3 10-minute bouts. There'll be some people that will tell you that due to an increased caloric expenditure after exercise, that 3 10-minute bouts are actually better than one 30-minute bout because the time in recovery for the 10-minute bouts will be longer in total than the time in recovery from the one 30-minute bout. And that time in recovery indicates a condition in which you're burning more calories still as a result from your body not yet ramping down from the higher intensity physical activity that you were doing. And those little bumps in caloric expenditure add up to a greater gain for the 10-minute bouts 3 times a day than the 30-minute bout 1 time a day. Now, there's some lack of agreement in the literature, so I hesitate to do that. I am a proponent of multiple bouts of exercise for that reason of that increased caloric bump, but I wouldn't limit myself to that. If it's more convenient for you to go do one bout of exercise at 30 minutes, by all means, get it done that way. Another key point is to tell you that there's no difference in health benefits that has been related by research studies for moderate intensity physical activity on 3 days a week for 50 minutes a day or 5 days a week for 30 minutes a day. So perhaps the guideline for 5 days per week, 30 minutes a day is too specific, but it's still okay to follow. And there are actually illnesses or diseases that could benefit from daily exercise. And we talked about every time you repeatedly contract your muscles, how it increases insulin sensitivity. And for that reason alone, you might metabolize the foods you eat differently on days you exercise. As a matter of fact, you might metabolize them better on days you exercise. And for that reason, I would always recommend that you participate in moderate intensity activity most days of the week. But volume is really the most important predictor of these health benefits. However, I will say it's less likely for somebody who can exercise for 50 minutes in one session or in one day to not exercise on other days of the week. So the 30 minutes on 5 days a week, 30 minutes is doable for many people who have not been exercising. It works into your schedule well, most people's typical schedule. And so the recommendation with regard to also metabolic responses stands as 30 minutes a day, 5 days per week. And we can argue which is better or worse. If somebody wasn't going to be able to exercise 30 minutes a day most days of the week, but they could do 50 minutes 3 days of the week, go for it. The research doesn't say that you're not getting the same benefit, unless, of course, you have some sort of a metabolic disorder. And in that case, the recommendations would change anyway. We have different recommendations for people that are special populations, those with high blood pressure, diabetes, etc. So these, remember, are for normal, healthy Americans. And when I say healthy, I use it loosely. Probably most of us are overweight or obese, but as Americans, that's just the state of our being as a country. But my point is, get out there and do something most days of the week. That's better, right? Now, the guidelines do suggest that 3 days per week is a minimum frequency, and that, vigorous intensity activity, if that was your choice, I'm just going to work out really hard 3 times a week, you at least need to do it 3 times a week. It doesn't say 2 times a week vigorous intensity activity. And there are some studies that say there's a minimum number of days per week, though it's not below 3, right? It is below. The minimum should be 3 days per week. That's what I meant to say. And I think I'll stop there with those points. I don't want you to get confused. Remember those 70, 75 minutes per week guidelines? That's vigorous intensity activity. And why does it count 1 minute of vigorous activity the same as 2 minutes of moderate intensity? Well, it's explained in detail in the appendix guidelines of the report. However, just think about this. The harder you work, the more calories you burn when you're working. The metabolic equivalents of vigorous intensity activities are 6 METs or higher. Moderate intensity, 3 METs to 5.9 METs. Therefore, you're actually burning more calories. You're doing more work. That's how we measure work, is in energy expenditure. You're doing twice the work at vigorous intensities than moderate intensities. Now, if you're a high moderate intensity versus a low vigorous intensity, is that double? No, but remember, these are general recommendations, which are average recommendations for the average adult. So if you were to calculate the minimums, and remember, that's what these are, minimum guidelines to meet health recommendations, 150 minutes at 3 METs is the same as 75 minutes at 6 METs. Right? That's 900 MET minutes either way. I'm sorry, that's not 900 MET minutes. That is so much bigger than what the minimum recommendations are. That is 450 MET minutes either way. I can't delete that. It's too difficult. So remember, 150, 150, 300, another 150, 450. So 450 MET minutes, moderate intensity, 450 MET minutes, vigorous intensity, because the metabolic value of the vigorous intensity is twice that of the moderate intensity, even at the minimum levels. I don't want to harp on it, but on the other hand, I want to harp on it. If you want additional health benefits, you will get that with higher volumes of physical activity. And this goes on to that argument is, so if I want to be healthy, I need to do the minimum to be healthy. But what if I want to be well? If I want to be well, I move forward on the continuum and I do more of the things that made me healthy, right? Now, that's not true for everything. I don't do more of everything and get a greater benefit, but we know that in physical activity and exercise, more is better to a point. There is a place where you could overtrain, but believe me, most Americans are not at risk for that. But more is generally better with physical activity or exercise as long as it doesn't induce injury. Okay, let's talk about the muscle strengthening guidelines. Adults should do muscle strengthening activities at moderate or high intensities that involve all major muscle groups on 2 or more days per week, as these activities provide additional health benefits. And I've described some of those. So when we talk about major muscle groups, really we're talking about legs, hips, backs, chest, abs, shoulders, and arms. when we talk about moderate to high intensity of effort, that means we need to do, some, multiple repetitions, but not too many, right? So we usually say 8 to 12 repetitions. That's how many times you actually lift the weights. And if you're doing weight training, you could just do that one time for each major muscle group. So maybe you say, oh, I'm going to go do squats. That'll get my hips and legs, and I'm going to do one set of 8 to 12 repetitions. So I'm basically going to go up and down 8 to 12 times. As a matter of fact, I'd go 12 on the bigger muscles and 8 on the smaller muscles. So usually you go lower extremity is 12, upper extremity is 8 to start out a program. Now, you can do one set, but you need to do this full body workout, one set of this full body workout at least 2 days per week. Now, your book says that your book tells you to do non-consecutive days. It just depends on muscle groups. So which muscle groups you're using on each day, because some people will separate and do upper extremity and lower extremity on consecutive days. But any muscle group you work should have at least 48 hours of rest before you work it again. So if you're doing 2 days a week and you're doing a whole body program both days of the week, don't do those on consecutive days. The only time you can go in and lift weights on consecutive days would be if you're doing different muscle groups. You're not repeating muscle groups on consecutive days. Okay, now let's talk about physical activity, not for health benefits, but for weight control. These physical activities do not include the dietary guidelines, but we know that to prevent weight gain, most studies recommend 60 minutes of physical activity to prevent weight gain with no dietary changes. Typically, we would say 60 minutes with dietary changes would cause weight loss. You would need 90 minutes to sustain weight loss, to keep losing weight if you have no dietary intervention. Physical activity guidelines regarding obesity as one of the many chronic conditions for which more is better. So something like 30 minutes is commonly not enough to obtain a healthy weight, but you'll still get health benefits from 30 minutes a day. That's a parallel to most other chronic conditions, that 30 minutes is commonly not enough to totally reduce your risk of heart disease, but it will make you healthier. It will provide health benefits. We can't specify with regard to physical activity alone how much is needed to control weight without specifically talking about dietary intake. But we can say that in order to prevent weight gain, there's a national registry of weight loss that was kept, which logged people who had lost weight and kept it off for 7 years or more. And it's a huge registry, and we found that those individuals engaged in a minimum of 60 minutes of exercise per day to prevent weight gain. And we could say that without knowing their dietary status. So if you want to attain weight loss, the first step is meet those minimum levels of physical activity. But if you can't do that, trying to jump into 60 minutes of physical activity will just be a turnoff completely. But the physical activity recommendations are get the minimum at least while you pursue dietary restriction. And then monitor your body weight with the minimum guidelines. For some people, the minimum guidelines actually may help them achieve a healthy body weight. But this is individual differences exist not only in our looks, but in our metabolic profiles. So many people require 30 minutes of moderate intensity per week to actually achieve a healthy body weight. And that goes back to the 60 minutes per day. It is important to both increase physical activity because that will help you maintain the weight loss that you achieve and control caloric intake. Any activities that expend calories will help you control your body weight, and physical activity is definitely one of those. Now, vigorous intensity, I know many of you have heard about something called HIIT training, high intensity interval training. It's a great way to get a real quick caloric expenditure, but it's not something that you should engage in every single day because of the risk for injury, and also because it's hard, and people who aren't meeting minimum guidelines may not be able to exercise vigorously long enough to get the gains they need. But you can use it as a more efficient way to achieve those increases in caloric expenditure, but it should not be your only avenue. The good news, again, here for people wanting to lose weight is regular physical activity provides health benefits, even if your weight doesn't change or even if you're gaining weight over time. Producing the caloric expenditure recommended by 30 minutes of exercise 5 days a week will still decrease your risk for chronic disease, as opposed to being sedentary, of course. Flexibility activities are acceptable. You know, they're important. Those recommendations vary as to who needs to engage in them. You at least need to be flexible enough to do the physical activity and the activities of daily living that you need to be engaged in. So there are stretching activities and other flexibility activities that can help you meet this goal. Of course, before you engage in physical activity, a warm-up is a really brilliant thing to do, a necessary thing to do. There is some insufficient data, like basically, so not warming up is not going to kill you, but it can actually put you at higher risk for injury. It doesn't increase your cardiovascular risk if you don't warm up. Now, cooling down is a little bit of a different animal in that if you have any cardiovascular risk factors, the cool down is very important. It's very important to gradually stop exercising. But the warm-up is more important with regard to reducing injury risk. Again, most of us are normal, healthy individuals, and the warm-up or cool-down or the lack thereof is not going to affect our exercise program outside of putting us a little higher risk for injury due to the warm-up or lack of cool-down. The warm-up and cool-down can count towards guidelines if they're at moderate intensity, but walking to warm up for a run, if you're not walking briskly, it can't. If you're walking briskly, it can. They are a common part, warm up and cool down, of exercise programs, and they actually make the activity feel more pleasant and are highly recommended for you to engage in. So a warm up, bringing your heart rate up gradually to your moderate intensity over a period of 2 to 5 minutes, and the cool down over a period of 5 to 10 minutes, bringing it back down closer to resting levels before you stop. Lowering the intensity gradually or increasing the intensity gradually for the warm-up or the cool-down is important. I'm going to go over the recommendations for older adults 65 and over fairly quickly, but hang in here. We don't have much left to cover.